Hello all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today we have Dr. Arun with us, who has done his MD in anesthesia, and now he is after that he did more than 1 year of critical care work, and then he chose to work in freelancing job. So the reason I called him for the interview is that you guys should know the pros and cons of doing freelancing, because many of you are choosing anesthesia. What you really think is you earn money in early part of career. That is what even I tell in my videos. So that doesn't happen when you are in a job in medical college or a government or a corporate hospital. That usually happens when you do freelancing. So that is why I invited Dr. Arun to come into our channel to tell us about his journey and how he decided, how he actually opted to be in freelancing work. Welcome to the channel.
Hi sir. Hi sir. Hi guys. I'm Dr. Arun. I did my MBBS MD anesthesia. Later 1 year of critical care experience in Manipal. Then I am passed from 6 months. I am into freelancing. So let me tell you how I started my freelancing journey. First thing, when I was doing critical care fellowship experience, after 6 months I started visiting hospitals. Meanwhile, in my free time, then I didn't get any call. In Bangalore full of senior anesthetists, and I was a bit whenever I get 1 or 2 calls initially I used to get. Later, slowly, after about 1 year of critical care, I am a bit confident and started moving more into freelancing. So that's how it started. But the crazy part is, when I got my first case in my Bangalore, I got one call from my friend that one so and so case is there, that too, peripheral part of Bangalore, it's outskirt. So I went and saw that was lab chole. Then went and they told lab chole cystectomy case, just start the case. And I was about to induce the patient, and suddenly OT technician is giving me, it was male patient, she started giving me 6.5 size tube. I was literally stunned. Like, what is happening here, sister? And I was about to induce the patient, I was holding mask and about to induce, and I'm stunned, and I'm asking what happened, sister. She's like, no sir, yesterday one anesthetist came and tried the case, she couldn't intubate. Then I literally put the patient back on oxygen mask, went outside, spoke to patient family. I told them, took some high risk consent, explained the surgeon. Then after that I came, I told surgeon, sir, again I'll try, if not I have to cancel the case. And surgeon is like, okay sir, you try. And luckily I could intubate with a bougie.
Oh, great.
Then successfully completed. This is how my first case started.
Yes. So basically, you decided to continue in freelancing work. That is a very good decision according to me. So what are the pros and cons?
Coming to the pros, first thing is the flexibility. I can decide my own schedule. I work usually 25 days in a month. Other 5 days I take off and go to my home. And 1 or 2 Sundays I am a national level chess player, so I keep for myself purely chess.
Wow.
That is what a lot of chess tournaments will be there in Bangalore. So that is one thing I can schedule my own. Visit own hospitals, schedule my own cases, and I don't do much of pediatric cases. More into orthopedic, spine, and gynecology cases and all.
Okay.
So that is first thing. Second thing is the income. Initially it's about case basis. I go do cases, and
what is the rough costing in Bangalore, like metros?
Yeah, metros, it's it varies again depending on the location and also depending on the experience you have. It's around, for spinal, around 3,000 to 5,000.
Okay.
And about general anesthesia, around 5,000 to 6-7 it will go.
In some centers they give 1/3 of the surgeon's charge.
That is there, but roughly it's around
it will
come. It depends, and it again varies depending on the duration of surgery.
Okay.
Initially, if you start GA cases 3 hours, they'll give you 5,000, and every hour it will vary.
Okay.
Yeah, that good inflation rate is.
For example, something goes for like 6 to 8 hours.
Yeah.
Then it will be more.
Yeah, it will be more. Of course, it will be more, and also you can charge separately for blocks. So income wise, it is very good. And also the very important thing is work-life balance. It's actually very good. You can maintain your work-life balance. Some days if you are off, I just put flight mode, I don't receive the call. I am like totally off. So that doesn't happen in corporate. That is why I operate more into this, because it's like a, it's fixed 8 to 5. When you have fewer family issues, you have to come and work. There is no
Yeah,
other
today I
stuff.
have a parent-teacher meeting, but I'm not able to go because he has visited. I took him inside the operation theatre. He has seen the complex work that we are doing.
Yeah.
I'm not able to go. Yeah, super. So freedom is what you get.
Yeah, freedom is actually, it's very important, sir.
Yeah,
And because
for
of
you,
this
basically,
hectic
chess also
schedule,
you play.
yeah, chess also I wanted like
Yeah.
future plans in chess also. So that's how I opted into this. Coming to the cons, again, income itself is a con. So first thing, some days it's not like every day you get the case. Some dry days will be there where you don't get a call, and or else last minute cancellations. Especially some patients will be posted, but because of insurance and all, they will just call about to, you will go travel after 10-15 minutes, they'll call and tell, sorry doctor, patient is not willing and all. So that is the one thing. And second thing is the job security. Most of the time, in-house anesthetists are there in Bangalore. So it's like sometimes they'll tell, sir, we have already got anesthetist. So anytime you can't expect 24 hours you will get a call. So job security is not there. And also the equipment and also the trained staffs are not there. So many times I have seen it's very hectic, like very stressful. You are whole and soul responsible for the case. You go, you see the patient, you intubate, and you see the suction, everything you have to see. Especially at night time, it's very risky to check all, and you have to monitor, meanwhile keep a watch on blood loss, and so everything, it's very stressful job.
And today you saw I induced a high-risk case, but 2 anesthetists are there.
Yeah. And there it's like one-man show. I am like, I should be the boss. I should see the head end, and I should talk to family. I'll talk to the patient before inducing. So post-op, intra-op, pre-op, all three, everything is on my head. It's very stressful. In many cases I have done just by putting EJV. I didn't get peripheral lines. No UVCs, no scanners.
Yeah.
So it's very difficult.
So then, so these are the pros and cons basically. So, but freedom is, I think all these challenges are worth taking for the freedom that you get.
Yeah, so that's
Correct,
actually it's worth. Yeah, it's actually worth, because doing, it's like machinery job 9 to 5. It's compared to that, it's actually a lot of freedom you'll get more in freelancing compared to the like corporate setup.
No, we are not recommending everyone to do freelancing now with this video, but we want to put forward the thoughts of a freelancer so that you can take an informed decision.
Correct.
So that is the intention of this video. But see, he has done 1 year of critical care experience and then he entered. So like that, some 6 months, 1 year, better to work somewhere.
It's better to work because immediately if you come into freelancing, it's very difficult, because even I have got difficulties during freelancing. Like recently, when I was doing one case, some African patient, 90 kgs, very muscular. It's just like a normal case, some shoulder injury, thought of doing under GA. Just when I went in, couldn't see anything. It's very difficult. Fully couldn't see anything, very difficult to patient. Then surgeon is like, sir, one more try you give. And again I tried second time, didn't see anything, no equipments, no fiber optic, no video laryngoscope, just with a normal scope blade. Then after that I just told the surgeon, sir, will cancel, better I don't take risk. Then like surgeon's like, okay. Then after 2 days they posted call some senior anesthetist, but even for him the same thing, he couldn't see anything. Later they referred to the higher center. There they have done with fiber optic. That is how it's.
Those kind of things would be very easy for us, because as you told, video laryngoscope, CMAC makes the difference actually.
So that we won't get.
So that is the advantage. But see, when the senior comes also, if equipment is not there, they can't do anything.
Correct.
So that is one of the challenge that you have to take. See, it's more about, you have to weigh your priorities.
Yes.
Your priority is freedom. He chose freedom, so he needs to take some kind of a challenge. I don't call it risk, it's a challenge. So, and then he has a backup plan. It is not that he's putting his patients at risk.
Yes.
It is like he gives an attempt. If it is not happening, then he told the surgeon that we have to plan it some other day. That is a plan B. Okay, so like that, you don't put your patients at risk, but you need to have strong plan Bs and plan Cs when you're doing freelancing. In a corporate hospital, even if you don't have a very strong plan B, you always have support of your HOD, you have support of another senior consultant, you have support of another consultant. So they will just pitch in, and with their experience, they will have some kind of plans immediately, they will get you out of the situation. But in freelancing, you are the whole and soul.
Yeah. First thing I prefer is patient safety. Actually, patient safety is first priority I'll give. Yeah, because whatever happens, you should never compromise on patient safety.
Correct.
And second thing is our safety, means medical legal is
Obviously.
safety is also important. I have done my indemnity insurance.
Correct.
So, and take high risk cases, high risk consent, documentation should be there. So that is all very important. And also the communication. When I usually do the case, I'll communicate first with a patient, then with the family, relatives, then I talk to surgeon.
Oh.
So everything, so that later if after something goes wrong, I can come back and tell them this is how it happens. Yeah, so that this patient will go into ICU. I'll tell them prior taking to high risk cases, and I had experience of critical care, so I can manage bit of high risk cases. So that is how second thing. And also, as you told, I have plan A, plan B. Sometimes 90% of the time seniors won't be there, but I will discuss just on call how it goes, how should I move. I'll have some rough plan. So if plan A fails, plan B, if plan B fails, plan C, so I'll make up my mind before starting the case.
You can call me for brain and spine surgeries in future if you have any major case like scoliosis or that.
Yeah, sure sir, I'll call you. Yeah, and I saw your setup also very good.
Yes.
Yeah, a lot of high-end machines and equipments, this monitoring SSCPs, MEPs and all. It was a very good setup.
This is the top-end hospital for neuro. So we have to deliver this kind of care. There is expectation from the patient and everything. So this is a different kind of setup. Here we work for the for high-end care, and we have to produce research papers. There is expectation from the organization, and we have to do audits, and then we have to see the patient satisfaction. So it's a different setup totally. So this will be a different ball game. So if you are working in a corporate setup, you will totally be trained in a different way. So, but freedom, as I told, might miss. That is the
that's the main thing. In life, it's like work, professional and personal life maintenance is very important, according to me. So because when there is no time for personal, there is no point in doing like professional.
That you realized in very early part of your career, and many people won't realize once they reach 40s and 50s, they realize that. So he got wisdom in early age because chess player, So then, for example, MD anesthesia with 2 years experience started freelancing, and like 1 or 2 hospitals are calling him. Daily 1 or 2 cases he's doing, and after 3-4 years, can he expect an increase in the load?
No, sir, there is no increase in load. That's what our anesthesia is like that. Like once it hit to the high phase, then it is a plateau phase. So we can't expect. But the thing is, the more hospitals you can keep your juniors and send them. So like I'll be the boss. If any difficulty, call me. I'll be within reach. That is what I planned. So down the line, maybe around 3 to 5 years, take some 3 to now like 2-3 hospitals instead of that, some 5-6 hospitals, and you can be the head.
So you'll cover multiple.
I'll cover multiple hospitals. So you can do like that. Simple cases anyway, juniors will do. So later, if any complicated, I'll be there. You just go ahead and start. I'll organize, and we can plan accordingly. And so that's what.
So you have a strong future plan also.
That's
true. So then. For example, if I usually tell the finances in my videos, and around corporates, if you join post MD, you'll get around 1 lakh only. So if you do freelancing after 2-3 years, I'm talking about, immediately I don't expect anybody. After 2-3 years, can they reach 2 lakh mark?
Easily you can reach. It's like around 2 to 3, 4. You can reach.
You can do. So guys, you think about it. If you're ready to take the challenge, and the equipment, what he's telling, actually I have a solution for that. There are new ultrasounds which are coming which can connect to cell phone. There are, but PNDT Act, your permission need that should be mandatory. So PNDT permission should be there. Through a hospital you have to get it. And then there are nerve stimulators you can invest in. Once you make money, you have to invest in that to increase the patient safety, and then maybe you can carry your own portable ventilator.
That's what.
So these kind of setups maybe you can make and build your own. And BIS monitoring also. there are portable BIS monitors,
Okay.
there are portable infusion pumps.
Oh.
So everything can be set in a kind of a case. So there will be a infusion pump, there will be a BIS monitor, there will be an arterial line set which you can connect. So everything you can design one. So there are designers available. I can give you some of the contacts.
Yeah.
So they can design a freelancer's kit.
Yeah.
Where everything
Hopefully,
can be set.
in future these things I can make use and improve.
I have some contacts. I'll
Yes.
give them to you. They will design for you, and then you can fit everything. So that can be a product that you develop.
Yeah. That's true, sir. Yeah.
For all freelancers, you can sell that product.
Correct. But actually, overall, if we tell, it's very stressful and very responsible to be a freelancer compared to working in corporate and all.
I understand. It will be overwhelming because you're alone, and being alone is a different feeling. Being with a team is a different feeling, and so you will feel overwhelming at some points. And but even in corporate, when you climb to positions like what I am doing, even though you have a team, but you will be the final point.
Correct. Yeah.
You got it, no?
Yeah.
So it is. I don't call it alone. My team will feel bad, but it is more like when you become
when
the
it
head
comes
of a
to
zone.
responsibility, it's more of
It is more like you sometimes feel that when you don't have a backup, when you are the highest authority, it is almost the same.
Correct.
I understand that feeling. It's an overwhelming feel that you get sometimes when you particularly stuck in a situation.
Correct.
No?
When everything is going good, it's okay. Anesthesia is very cool.
Very cool.
Okay, 99% nothing will happen. But when it comes to one or two cases, you are totally that point. You will be like, why I am into freelancing?
Exactly.
That feeling.
That's an overwhelming feeling that you get. And the only way I actually sorted that out, because multiple times I got involved, since I've been head since many years, many times I got stuck. So what happens is you get into an overwhelming situation, the next overwhelming wouldn't be so hard.
Correct.
Again you get involved,
Yeah,
get involved,
yeah.
get involved, repeat.
I think you get used to it.
I get used to it. By doing percutaneous tracheostomy, particularly I got stuck sometimes.
Okay.
You get into a kind of overwhelming situation, you'll feel like stopping the whole thing. So now I reached a position where in 2 minutes I'll finish up. So even now if I get stuck in a situation, now I devise my own ways of coming out. So it's more like repeatedly you have to get in. So maybe in 7 to 8 years into the freelancing practice, you will have your own kits, you will have your own methods, and like how you organize.
Yeah, my own protocols.
Your own protocols. And like my close friend Dr. Nagesh also, he's the head of director of Kaveri Hospital. So even he started like you actually.
Okay.
So when I was doing DM, he finished his DMD and he's taken over some hospitals like that. And now he's a very big guy. So I hope you also become like him in future.
Hopefully.
He has taken over many hospitals and all that. So and then. So guys, then this is about the freelancing, and we all told you how much money you can make. We told you pros and cons, and we told you the different challenges that you will face, and the advantages like freedom that you get. So any comments if you have, you put in the comment section, and I will put forward from him, and I'll take the information, I'll give it back to you. Any conclusion points you want to tell them?
The thing is, first thing for immediately who have finished now, who are entering into the first year PG for anesthesia junior residents, I tell for any cannula they call or any difficult intubation that they call in casualty, please attend everything. Don't even a small cannula also, it's a big challenge when you come outside the hospital. So that is for first years, do more and more cases, see more and more complications and high risk cases and all. And when the people who are coming out now, who have finished anesthesia freshly, passed out, they can join some corporate setup, either regional anesthesia or pediatric or critical care. So later they can slowly move into freelancing on their own domain, in which they are interested. Or else if you are comfortable with 9 to 5 job, I recommend for those people also can go and simply work under corporate, not an issue. Or else even medical college also same thing. 9 to 5 can go punch aram se. Under you so many PGs will be there. So it's like kind of like 9 to 5, nothing much. Hectic, so that's all.
But even then you have to go 9 to 5.
Yeah, that's
again our whole concept of freedom is gone.
Correct. Yeah, freedom you won't be there. You have to be there 9 to 5, irrespective of whatever schedule you have. So that's how it works. Or else you do freelancing like me, you can make your own schedule.
And people will prefer the freelancers who are available all the time.
Correct.
See, if you are in a medical college, if you tell I'll come only in the evening, Sometimes case will be there in the morning. So then they will obviously prefer Dr. Arun only, no?
Yes.
Because for me, I want a person who is coming at any point of time.
Yeah, early morning 6 o'clock they
6 o'clock
start the
will be there,
cases.
yeah.
Spine and all. Some surgeons start at 5:30.
Spine surgeons are like that.
Yeah.
Early morning they'll
Early morning. So headache. I don't know how they are having, 5:30.
Actually, they go for OPD after
Yeah,
that.
and
Rounds.
late nights 10:30, 11:30 they start and sleep at 2.
Correct.
This
They
sleeping
are a
pattern.
different species actually.
Yeah.
They work like that. Surgeons are different species. If you ask me, the toughest specialty on the planet is surgery.
Yeah.
Let it be any, let it be ENT, opthal, or ortho, or general surgery, or any super specialty surgery is very tough.
Yeah.
It's very tough. It's because it is, some specialty advice also I'll be giving in my channel. Any surgery is tough because surgeon is the final fellow for whom the patient would be coming in future.
Correct.
Everything he is responsible. So he is like, he'll be thinking about the case, he has to perform, and then he has to operate, and then follow up, and then complete thing is.
He will be talking to the patient,
Patient.
till the patient gets discharged. That's difficult.
As a freelancer, you actually help the surgeons in getting
Yes.
things.
First thing is you should impress the surgeon.
Correct.
That is what very important.
Write down important points.
Freelancing. yeah. Instead of first go and talk to the surgeon, impress the surgeon. Then only he will call for the case.
Yeah.
Or else, if you show attitude in front of surgeon, then it's very difficult to work with him because our bread and butter are from more than patients, surgeons. So surgeon's call is very important. You should gel with them.
Correct.
And spend some time, talk with him. What is the case? How many hours of the surgery? Then you can talk plan. Some surgeons are adamant instead of giving block, they want GA.
Yeah.
So for general anesthesia, if he is asking, then you have to go for general anesthesia. So it's not like.
He will be asking with a reason.
Yeah, he's having some plan.
Some plan because the patient is anxious or something.
And all. So that time you can't say I am good at blocks. No, that doesn't work. You have to give GA. So
it's a very important point what you told. Even in corporate, if you want to shine. So thing is like some people are messaging me, are anesthesiologists slaves to surgeons and all that. See, it is not about slavery. It is about collaboration.
Yeah.
It's all about you help them and they will help you.
Yeah, it's about adjustment.
Yes.
About
if you resist them, they will also resist you. So that is not a very healthy environment. So if they ask something, you give. If you want, they will this thing. See, if I want to cancel a case, if patient is not fit, I will tell, they will understand. If they then it's more like then if they ask something, if I don't really want to do, I'll explain. If they understand, I will try to do. Otherwise, I'll try to modify here and there something and then do it. So it's all about collaboration. So if they understand that you are actually trying to help them, and then they will also actually wouldn't come against you.
Correct.
So it's more about collaboration, not slavery. That's what you guys need to understand. And your comment, same thing.
Yeah, same thing, sir. Yeah, better. The only thing is you be good with surgeons, good with patients. Don't compromise on patient safety. So that's how it works when it comes to freelancing.
Yeah, I did freelancing in 2012. So I was preferred in that area because I used to go very quickly.
Okay.
Will that matter?
Yeah. That is the first thing. Whenever they call, you have to be very quick. You should be on toes.
Okay.
Yeah, anytime.
Even now it works.
Yeah, even now it works. Or else next time they won't call you. If you are making to wait surgeon. So they won't call you. They'll prefer another anesthetist who will come very fast. Because even they have some other plans.
Correct.
So and some other OPDs or some other patients will be there. So first thing is, as you told, time is very important. Even now, if they call at 6:30 or 7, I'll be 15 to 30 minutes before, so that I can go and check the OT at least and see the equipments, and I'll double check the patient PAC, because everything it's me who will do. So I'll be knowing. That's how it's very important better to be on the safer side. Even during my PG days also, I used to go 15-30 minutes before. And that what carried me till now.
Yes, there are some personality traits are required. You have to be smart, you have to be fast, you have to be good in your procedures.
Correct. Yeah, skills is very important. Your knowledge and skills. Actually, before I used to not do much high risk when I did this fellowship. Critical care. After that, I am very good at this central lines and all. Very quick. You should immediately put central lines and take arterial catheter, cannulas and all. So you should not waste time, because later the surgery gets delayed. It's problematic for surgeon also. So you should be very good in skills and also the knowledge and recent updates.
And the most important, crisis management. That over a period of time you get that. But the thing is, from PG time, try to involve yourself, as you told, in all the crisis situations.
Yes.
Correct.
Yeah, yeah.
You don't avoid it. You
Yeah.
get involved in that.
Correct. When we are in usually first year, second years, we will just leave the OT if there are complicated cases.
Correct.
That you shouldn't do. You should be there, stay there, at least see what seniors are doing. That will help in very long run. Now it will help you. Even a small cannula, if no one is getting, if you had put, that will make lot of difference when it comes to freelancing. So, and you should have some also the plan A, plan B, plan C, everything, talk to the seniors, even talk to the juniors, talk to the locality people or your colleagues who have done cases previously there. So you will at least get 1 or 2 suggestions.
Correct. And confidence is important. Confidence comes from the crisis management.
Correct.
If you are confident that you can manage any crisis, the way you talk automatically changes. So that is how actually my close friend Dr. Nitin is in Cleveland Clinic now. He was very confident. So that is because he knows that if crisis comes, I can manage.
Correct.
So it comes with that. He was like, so more in the PG time, I request you to get involved. If some crisis is there in some other OT number 23 crisis, go there and
just
stand.
code blues and all you run.
Run and rescue people.
Correct.
So even a small hypotension, ECG changes, desaturations, ETCO2 changes, all these things you have to get involved. And then what happens is all kind of combinations, permutation combinations you would have seen. Then you get more confident. Yeah. So that is how it is. So then, so that's the thing, we covered everything.
Yeah.
So thank you very much for coming into the channel. This video will help many people. So he actually helped us. He came to our hospital to give this interview for all you guys because the counseling season is going on. So many of you are interested to take anesthesiology, I know. So I really wanted you guys to watch this video before you take a decision of anesthesia. And since freelancing is a significant part of the anesthesia career, okay. So thank you all.
So that part you cut.